All right, hi everyone. It's about 7 o'clock, so we're going to go ahead and get started with the webinar here. Thanks for joining us. I am Dr. Sally. I'm going to be sort of guiding you through the webinar tonight. We're going to talk a little bit about what Regenexx is, and I'm going to go over a little bit about how we're using this as an alternative for orthopedic care and pain treatment. So, start with a quick introduction. My name is Dr. Jess Sally. I work with a group called Regenexx Pittsburgh. I graduated in 2003 from Virginia Tech. Graduated with a Bachelor in Science. Went on to my medical education at the Virginia College of Osteopathic Medicine, also in Blacksburg, specializing subsequently in physical medicine and rehab. And subsequently, again, sports medicine and spine. I did my fellowship at UPMC. I also like to snowboard and cycle. So as I said, I'm with a group called Regenexx Pittsburgh. These are my partners, Dr. Mark Adelsheimer and Dr. Paul Lieber. We all share practices. Our main headquarters is in Pittsburgh, but we also have offices in Monroeville, Bridgeville, Washington, and Sewickley, so all surrounding the greater Pittsburgh area as well. One thing that we are stressing right now is that our office is a max COVID-19 protection zone. We are following all regulations of the CDC at this point. Our entire staff is now currently vaccinated, and we are taking all the precautions with masking and doing everything that we can to make sure that everyone is safe. So part of the reason why you're here is to hear some additional options in terms of what we can do to help you with reducing your pain symptoms. So, part of the reason that we want to do this is to help you reduce pain, and secondarily, help you avoid surgery. And that comes with the additional benefit of avoiding any downtime or additional rehab after surgery. And it's also a good option if you're not a surgical candidate. So a lot of people just want to know what their options are in terms of care, and they don't want to rely on medications or the old adage of, you just have to learn to live with it if things aren't going well in terms of conservative treatment, and you're not ready to slow down and you want generally more out of life. So as far as our agenda for today, we're going to talk a little bit about what Regenexx is. We're going to talk about current options in terms of the different treatments that Regenexx offers. We're going to talk a little bit about the ideals behind interventional orthopedics and how Regenexx, in terms of our procedures, are different from your standard orthopedic care. And then we'll go over a little bit about who this is for and what kind of results you can expect. So as far as how this transitions, the future of medicine in general, I believe, is going to be more biologic. We're focusing on shifting from management of certain processes to repair of tissues. And essentially, we're using the body and the body's processes to really help it heal itself. So in order to understand that natural healing process, you have to understand how the actual healing cascade works. So in a lot of cases, we have an initial injury, and it can be as simple as something like getting a cut on your arm. That cut forms a clot over top of the injury. The clot releases the platelets and the growth factors and everything that helps with the healing process. And then the result is inflammation. And the inflammation is a signaling process that actually is used by the platelets to call in the stem cells and the immune response, and basically everything that comes into that area to help with subsequent tissue regeneration and then tissue remodeling. And then eventually that clot goes away and you get complete healing of the tissues overall. So when we're talking about normal cartilage metabolism, this is kind of a busy slide, but basically the takeaway from this is that we're looking at shifting from degeneration, which basically means that the breakdown in a joint outweighs the buildup that happens in the joint. And what we're trying to do is we're trying to shift the weight in favor of the buildup. And that's what's going to help with pain relief, and that's what's going to help with just better function in general. So the ways that we offer regenerative treatments are through a couple of different avenues. One is stem cells, which you probably have heard of. Another is platelet-rich plasma, also referred to as PRP. There's also something called platelet lysate, which is a different form of PRP that we use in the spine. And then there's prolotherapy, which is a very old form of regenerative treatment that we also use in conjunction with the others. So what are platelets? Platelets are found in the blood. Everybody has them. It's basically what contains your clotting factors and your healing growth factors. They help to speed up repair of tissues, and they also contain things like serotonin, which helps to calm down pain and helps with relief overall as well. They also attract stem cells and help to activate them. So they work side by side with stem cells to help in the repair process. As I said, there's two different forms of platelets that we use. One form is called platelet-rich plasma, which is PRP. Platelet-rich plasma is used for treating joints, tendons, ligaments, cartilage. It can concentrate platelets based on patient need, and growth factors are released slowly from these platelets. It's kind of like an extended release pill almost. With platelet lysate, that's a little bit different. We use this with our spinal procedures. Essentially, this is where we take the platelets and break them open, and then the growth factors are immediately available in the area. So we can use these around nerve entrapments, such as things like carpal tunnel or nerve entrapments in the spine or disc-related issues as well. So what is a stem cell? A stem cell is basically an undifferentiated cell. These cells live in the bone marrow, and they basically don't have a job until a job is given to them. They're held in reserve until repair is needed somewhere else in the body. And then the signal comes in and tells them to go to the specific place that they're supposed to help with the healing. They can turn into many different types of cells. We use them more specifically for treating cartilage, bone, muscle, tendon, ligament, and they're also good for helping to regenerate blood supply and blood vessels. They're self-renewing, basically meaning that they self-renew in the bone marrow along with in the joint. So they, when you use stem cells and you take them out of the bone marrow, they come back. They regenerate their own numbers within the bone marrow. So you always have them at your disposal. There's not a finite number of them that goes away over time. So even if you're older, even if you're advanced in age, you still have plenty of stem cells left. And we use them just as we would in anybody else that's in their younger years. And like I said, stem cells are great for providing new blood supply to areas. A lot of areas that we treat don't have great blood supplies, like tendons and cartilage. So the stem cells help to bring that blood supply into those areas, and it makes the healing process that much better. At Regenexx, we're talking about adult stem cells. We're not talking about embryonic stem cells. We're not talking about any other form of adipose or anything else. We do use some adipose-derived stem cells because there is adipose-derived stem cells contained in the bone marrow. But mostly we're using mesenchymal stem cells that you find in the bone marrow itself. And we're not using anything that's more of a third-party product. So 80% of our procedures are usually driven by platelets or PRP. The other 20% are usually more surrounding stem cell treatments. There is a significant cost difference, but not everyone needs stem cells. So even if you have some arthritic change or pain or issues surrounding a joint, it may not always be a stem cell issue. So Regenexx as a group of treatments is actually what we use to provide an alternative to patients for orthopedic surgery and for your standard pain treatment. It's interventional orthopedics, basically meaning that we're using more needle-guided interventional procedures like injections rather than doing big orthopedic surgeries where we're cutting and cutting out and stitching and sewing and doing all sorts of other invasive techniques. We're using these orthobiologics, such as the platelets and the stem cells, to basically take the place of these standard orthopedic surgeries and do these treatments under guidance with needles rather than scalpels. This is more advanced regenerative medicine. We've taken a lot of time and training to do these procedures very properly and precisely. And so this then becomes a trusted alternative to your typical orthopedic surgery route. So the different types of conditions that we treat, number one, arthritis. That's one of the main ones that people are seeking treatment for. We also treat tendonitis, whether that's new or old. It can be chronic. A lot of people have tendonitis in their shoulders and elbows and knees that lasts for years, and we can treat that easily and quickly. Torn ligaments, whether that's any joint, shoulders, knees, elbows, ankles. Meniscus tears, we hear about commonly in the knees. Also spine pain. We're using these treatments to treat spine issues, whether that's spinal stenosis or arthritis or radicular pain from nerves, and disc issues, like I said, for degeneration in certain instances. Bone damage as well. We can actually use these stem cells to inject into the bone to actually regenerate bone tissue that's gone bad in arthritis that's more advanced. Common treatment areas, really I tell everybody that we treat everything from the top of the head to the tip of the toes, but the shoulders, the elbows, wrist, hand, thumbs, hips and pelvis, knees, ankles, feet, big toes, and the spine, as I said before. So the common areas that you would typically go to the orthopedic surgeon to have surgery or injections or anything along those lines, we treat those very effectively and easily for people. So the current options for orthopedic care, like let's say you just went into your PCP's office or you went into an orthopedic office and you said, I have this pain in my knee or I have this pain in my shoulder, help me. What's the first thing that they're going to do? Typically, they're going to go to pharmacology or medications. That could be over-the-counter medications like Tylenol. It could be anti-inflammatories, or it could even be, in certain cases, opioids. I have seen that still floating around in practice today. They're going to go for non-surgical methods, possibly things like steroid injections, hyaluronic acid, things like nerve ablations or bracing, chiropractics, physical therapy, all the options that you would typically hear or see about at this point. The next option would be surgery. So then if those things don't work, the next move is, we go to a replacement or we go to remove parts or repair things or take things out. So we are looking to actually provide an option that sits between those non-surgical options and farther surgery. Again, these are injection-based treatments. It's not surgical. Everything is performed under guidance, we're looking to do regeneration and renewal rather than removal and cutting things out and replacing. So if we look at surgical orthopedics, there's new studies now that say that the dominant form of care in the 21st century is probably going to not be surgical. It's going to be more allowing the body to heal itself. If you look at research, 95% of meniscus surgeries just remove meniscus tissue that's normally needed for spacing and for cushioning. Research now shows that removing that meniscus tissue just speeds up the onset of the arthritis and actually causes more arthritis more quickly. So the adage with this is let's stop cutting things out and let's start looking at injecting biologic agents that can help tissues heal instead. With interventional orthopedics, we're looking at replacing invasive surgery with precise image guidance or needle-based procedures using things like ultrasound or fluoroscopy, which you can see pictures of. Fluoroscopy basically meaning X-ray guidance. And again, our goal is to use less invasive procedures to avoid more invasive surgeries. So there's a couple different levels of accuracy that we talk about when we're looking at stem cell injections or just injections in general. We are talking, when you look at the first option, about 50% of physicians will do blind injections, basically meaning that they will line up the injection based on landmarks without being able to see beneath the surface or knowing what's under there, and they'll inject that way. Plus or minus on whether or not they hit the target that they're searching for. Low accuracy guided basically is a similar technique using more landmark based or drawing on the skin. Precision guided basically means that we're using techniques such as fluoroscopy or ultrasound guidance to get that needle exactly where it needs to be. And that's only about 5% of doctors doing that for their injection procedures. But in the Regenexx conglomerate, we use this for almost every single injection that we do. And if we're talking about precision, you can see here, this is what a injection for the shoulder would look like for the shoulder labrum. And this is a precise needle placement into the labrum, which is the cartilage on the top part of the shoulder. And you can see the contrast line into the joint and then the injection into the tissue, which needs very precise needle placement to get to. Again, needle placement under ultrasound guidance. This is an image of a needle going into a tear in the rotator cuff. And you can see that the needle gets placed exactly into the area where the tear has formed in the tendon, so we can deliver those orthobiologics directly into the place where there is damage. The result with that is, number one, less pain. That's what everyone is really looking for. And increased function, which is usually the secondary result of that. When you feel better, you want to move better. And then usually people have better mood. They can get off of their pain medication, whether that's over-the-counter medications or opioids. I've seen that in a lot of cases where people can really cut down on a lot of their medications significantly and quickly, and really getting back to your preferred active lifestyle without having those hindrances. So looking at the Regenexx differences, we're going to go over a few things that are really important when you're looking for a clinic that's going to provide these treatments for you. Really, one of the most important things is the specialist that you're going to be seeking out. So it's important because you want your doctor to be an expert in musculoskeletal care that is trained with the specialty and does it better than the vast majority of doctors. And you only want a physician. You don't want to be looking at nurse practitioners or PAs. You also don't want to be looking at somebody that's a chiropractor or somebody that dabbles, non-specifically in these types of treatments. You get an expert physician with the knowledge and skill level and experience to be able to deliver these treatments effectively. You're not looking at a dabbler or somebody that took a weekend course in how to give quote unquote stem cell injections. And you have somebody that has exact fellowship-based experience in these types of injections. And what it means for you is that you get the right doctor who can make the right diagnosis, which is super important. You want to make sure that you're treating the right stuff and provide the right treatment. And that's key to the success of these treatments. The next thing that's very important is the cell source. It's important because you want to be dealing with a cell source that meets the safety, viability, and compliance levels with the FDA. You want to make sure that it's only your own cells from your bone marrow. You want to make sure that the cells are alive and are in fact able to provide that regenerative function. And then you want to make sure that those cells are properly dosed. You want to make sure that you have enough of those cells to be able to deliver effective treatment. Regenexx offers the most researched procedures that we have available for these types of regenerative options. And that gives you a better peace of mind, better results, and gives you a better value of the treatment for longer benefit over time. The harvesting is important because you want to be able to get the most cells. You want to be able to get the most cells that are the most viable, and you want to be able to get them from your body, your bone marrow. So we have you want to be able to get the highest dose of cells possible and harvested with the best technique and the least amount of pain. Regenexx offers the patented options of the way that we draw these bone marrow cells to, again, give you the highest dose possible and give you the best treatment possible. We know how to extract the most cells from the body. You receive the maximal dose that you can get from the bone marrow with the greatest possibility for success. And we're looking, and the bigger difference here is that we're looking at a holistic approach to a patient's care. We use something called the SANS method. And basically that looks at all the different aspects of a joint and how a joint functions, the stability, how the joint moves or the articulation of the joint, the neuromuscular aspect, how do the muscles affect the joint, how do the nerves affect the joint. And we look at the symmetry. How does it compare to joints on the other side of the body or other joints that it affects up and down the chain? We're looking at structure, we're looking at function, and we're looking at just how we can make your body the most movement efficient that it can be for the best outcomes. As far as safety goes, Regenexx has published one of the largest safety papers in the world. This looked at over 2,000 patients and looked at the adverse outcomes. Really, the takeaway from it is that the procedures are very safe. The most commonly reported adverse reaction in the study was just pain at the injection site. And most people did very, very well with these treatments. The last part of this is you have to be careful of who you can trust with these different types of procedures. Again, we are performing specifically bone marrow derived stem cell treatments. If you look at this table that I've put on this slide, you can see these different wells here and these little purple dots that are contained within these wells. These purple dots are bone marrow cultures or stem cell cultures that have grown from bone marrow of middle-aged adults. And these adults were between the ages of 50 and 70. If you look at the wells on the other side of the screen, they're blank, they're plain white. These were cells, samples of a mixture called Livion Pure, which is touted as an umbilical cord stem cell product. And you can see that those stem cell cultures don't grow at all in these plated collections because there's actually no live cells in these mixtures. So anything that's touted as amniotic, placental, umbilical cord, Wharton's jelly, anything that's used as a quote unquote stem cell treatment actually contains no live cells. And this has actually been proven in multiple different research studies across multiple different labs of very highly rated universities. Another big myth that people talk about is they say my stem cells are too old. Well, that's just not true based on our specific peer-reviewed data. Older patients using their own stem cells didn't fare any differently than younger patients. And in a lot of cases, I've actually been able to culture many more stem cells from older individuals than I can from even individuals in their 20s to 40s. The stem cell product contains dead cells when compared to a person's actual bone marrow, which contains their own live stem cells. So anybody that's telling you that your stem cells are too old and offering umbilical or amniotic stem cells, they're actually trying to sell you a product that contains no live cells at all. So big red flags to look at when you're looking for clinics. Heavy emphasis on discounting or financing is a big red flag. We always look at what's going to be the best treatment for you, and we are upfront about anything that's related to that in terms of cost. If it's touted as a magic cure-all, basically meaning that they treat things like multiple sclerosis and Alzheimer's and autism and all these other things, there's actually no research-based use for any type of stem cell or PRP product with that. If they say that everyone's a candidate, that's something to be cautious of. We evaluate everybody and give our opinion on everybody's candidacy based on your examination and looking at imaging and all these other things. And we'll give you a real outlook on what we think we can do and how helpful we think we can be. Again, if they're offering amniotic or placental or cord blood products and calling them a quote stem cell procedure, there are no actual live cells in those mixtures. If they're treating with specifically fat or adipose-derived stem cells that they're taking directly from fat, that's really processing that stem cell mixture effectively is illegal in the United States, and it's something they shouldn't be doing at all. So when we're talking about the differences in terms of the visit flow, if we're looking at PRP-based treatments, with everybody, our initial evaluation is about an hour long. When we're doing the actual treatment, it just consists of a blood draw and doing the injection of the platelets on the same day. It usually happens about an hour apart. After that procedure, we usually send people to physical therapy if necessary, but usually I tell people to start that within about a week after the procedure. People follow up at about 1 month, 3 months, 6 months, and 12 months, even up to a year, to see how we're doing and see how things are evolving after that. When we're talking about stem cell procedures, that's a more complicated procedure that takes several different steps to accomplish. There's actually 3 different appointments that we go through and 3 different treatments that occur over those different appointments. The first treatment is prolotherapy. The second treatment is using stem cells and platelets all at the same time to treat the area. And the third appointment, we just use platelets, again, just derived from the blood draws. The stem cells are harvested from the area on the backside of the hip called the iliac crest. Everything's processed in our own lab in our office, and everything's injected into that area on the same day. So nothing ever leaves the office or is processed through any type of third party. With the stem cells, again, you have a 1-hour initial exam. Day 1 with the prolotherapy, that's where we till the soil. We're preparing the joint to accept the stem cells and get everything ready. Day 2 is when we plant the seeds. That's when we extract the stem cells from the bone, like I talked about, and we re-inject the cells into the area that's damaged a little bit later. And then day 3 is when we fertilize those cells. So we take the platelets from the blood and we use those almost like Miracle-Gro for the stem cells when we re-inject it that same day. After that, people usually go to physical therapy, like I said, about a week later, and the same follow-up, 1 month, 3 months, 6 months, and 12 months to see how everything's going and making sure that the procedure is taking hold and people are getting effectively better. Post-care physical therapy, I think this is super important for patients. I prescribe physical therapy to almost all of my patients, and I think it does very well in terms of getting people back to a better place from a strength and functional movement perspective. The best thing about this is that your physical therapy timeline is usually about 60% less after these procedures than it is for surgery. So you're not looking at extended months worth of physical therapy. You're looking at a couple weeks, probably pretty easy progression, focusing on improving motion, stabilization, and general strength. This is going to help with just improving pain, and it's going to help with improving your movement. You can do this in person. You can do it on your own at home under the direction of the physical therapist. So you have options in terms of how you can progress with this following the procedure. The referring providers, meaning us, are always available for questions to the physical therapist. So if there's any question in terms of the process afterwards, they can always reach out to us, or you can reach out to us to ask any questions about about what you're doing there. So who is the Regenexx procedure for? It's for really everybody, but it's mostly for people who want to avoid surgery. And in the course of doing that, keeping all their parts. It's for people that don't want to have a lengthy downtime or a lengthy rehabilitation process after a surgery. Like I said, the rehab process is cut down to weeks rather than months. People that don't want drugs or heavy duty pain medications after procedures. Like I said, we're usually helping people get off of medications, not getting them onto medications. It's for anybody that's had failed surgeries in the past. Especially for people that have had maybe a knee joint replacement, didn't like the experience, and then want to have a different approach to the other knee or a different joint. They know somebody. If you know somebody that's had a bad outcome from surgery and you left a bad taste in your mouth, and you want options in terms of what you can do otherwise. Or maybe if you just have medical contraindications for surgery, maybe it's your age, maybe it's your health, maybe there are things that it's not, it's a little more risky for you to do surgery. This is a great option in those settings. Or if you're too young for surgery, we do see that in some cases where patients have a lot of problems that they don't want to progress to surgery yet because they're likely going to need revisions or replacements down the road as well. When we're talking about cost, there's a lot of different ways that this stacks up. Prolotherapy is usually our least expensive procedure, followed by platelets, and then platelet-based treatments for the spine, and then the stem cell treatments later on, like I said, are more expensive. We see everybody and evaluate you on the basis of what your problems are and what we think is going to be the best treatment for you. And like I said, usually 80% of our treatments overall are more platelet based. Insurance covers everything that we do outside of the regenerative treatments. So things like your initial evaluation, your consult with us, your follow-ups, any diagnostics that you might need, whether it's imaging or whether it's lab work or anything along those lines. And any also bracing or physical therapy after the procedure is also covered by your insurance. Insurance doesn't cover the regenerative procedures themselves. So the prolotherapy, the PRP, the platelet lysate for the spine, or the stem cells. But keep in mind, with copays and deductibles, if you have them, you may actually be paying more out of pocket for traditional orthopedic surgery or traditional interventional care than you would be for these treatments, just because you're paying for, OR time, you're paying for surgery center time, you're paying for recovery, rehab, subsequent office visits, all these other things that add up very quickly. And again, we're going to give you a customized treatment plan that has a wide variety of price ranges. We are seeing some additional insurance coverages with some self-funded employers, which is great. This isn't a universal thing yet, but it is becoming a little more popular. We now have 6 million lives that are covered by these employers. So it's worth looking into for your job if the Regenexx procedures may actually be covered. You can ask your HR department about it and see if that's something that they've gotten on board with, or if there's something, or if they're interested in that possibly. These are some of the different companies that have already joined on with that, and the list grows every day. We also offer supplements with the procedures, our advanced stem cell support formula, which offers great supplementation for tissue regeneration, joint health, anti-inflammatory supplements, and it's great for muscle recovery and joint recovery after the procedures, or just in day-to-day use as well. We have omega-3 fish oil, which is also great for just systemic inflammation, brain health, and heart health, and the turmeric curcumin complex, which is good for general inflammation and pain as well. So where can you find us? We have offices, like I said, all over the city of Pittsburgh. Our main office is in Fox Chapel on Gamma Drive in RIDC Park. That's where most of the procedures are performed, and that's where we see a lot of our patient population. However, we have satellite offices. Specifically, I see patients in Bridgeville and Washington in the South Hills. And we also see people in the West, in Sewickley, and in the East in Monroeville. So you have plenty of options in terms of where you can see us or where you can touch base with us and follow up. So the next step is to contact us for an in-house phone consultation. You can reach us at the number here, and you can arrange an appointment and come see us in person to talk about what kind of treatment options that we have for you moving forward. So at this point, I'll open it up for questions. You guys can ask me anything about the procedures, and I'll be happy to answer any questions that you may have. I'm not seeing any questions at this point just yet. There's one question. I don't know if I'm necessarily getting the question. The ask is, what is the average cost of the treatment? That is a very widely variable question. It just depends on what kind of treatment we're actually performing. And that's based on, your examination, and that'll be based on the discussion that we have, it depends on what area of the body we're treating. It depends on, you know, a lot of different things that we'll review with you in the course of, you know, seeing you and performing the consultation, and we can give you a better idea of that, you know, after we see what we're dealing with. I have low back pain. Can this be addressed? Absolutely. We do low back pain treatments all the time. Like I said, most of that is platelet-based treatment that we use to treat those areas, and the success rates with that are very, very good. So we do low back treatments all the time. I did a couple of them today, actually. So. Hips are also a problem. Hips are also something that we address. You know, that is something that we see commonly too, is that people will have low back pain, but they'll also have hip pain associated with it. So, you know, there's, like I said, we don't just address necessarily the area that's always specifically the problem. We also look at, you know, like I said, we take a holistic approach to our treatments. So we're looking at areas both above and below where people can have problems. So we can address hip issues as well. How does this differ from a non-invasive surgery for a bulging disc? It's different in the fact that we're really, I don't know what kind of a surgery you would be having for a bulging disc, but surgery for a bulging disc is invasive. They call it non-invasive or minimally invasive. But there's no such thing as a non-invasive surgery, really. Our treatments are different basically because we're using needle guidance to treat the areas. So if you're looking at the disc, if you're looking at disc bulging, we're looking at needle placements to actually help with reducing the disc bulging and reducing any nerve inflammation that may be associated with that. And then also stabilizing the areas around in the lumbar spine or in the neck that are creating stress on that bulging disc and causing more pain. Yeah, I mean, like I said, you know, we treat arthritis all over the body. You know, it's not just in, you know, specific areas. We have options to treat lots of different things and you know, give you different options for pain relief depending on where the major issues are coming from. A lot of times the low back will create problems all the way down the chain into the legs. And I've seen that in a number of cases where people will have issues in the hips and knees and ankles based on the fact that they have inflammation in the spine. And we can talk about more of that, you know, if we see you in clinic. Any other questions? You guys are asking really good questions right now. So, you know, it's wide open for you if you want to reach out and ask anything. Well, if not, I appreciate you guys being here tonight and listening to me. If you do think of any questions or if there's anything, thanks, Jeff. If there's anything that I didn't get to, or if you want to know more about, you know, give us a call. Like I said, 412-963-6480. We can answer questions for you then. I'm happy to see you guys in person, and we can go over a whole bunch of different information that will probably give you a lot more answers to your questions. But feel free to contact us. Feel free to reach out if you want any more information. And we hope that we can be of help to you. Thanks for sitting in on the presentation tonight, guys. I really appreciate it. And we hope to see you soon. Thanks.